Allen test. Allen test is used to assess the collateral blood flow to the hands, generally in preparation for a patient for any procedure has the potential to disturb blood flow in either the radial or ulnar artery. And there are procedures include the arterial puncture or cannulation and the harvest of the artery alone or as a part of the forearm clamp. Coming to the introduction, the Allen test for blood flow was first described in the year 1929 by Edgar V. Allen as a non-invasive evaluation of the arterial patency of the hand in patients with thromboangiitis obliterans. So shortly we will call it as TAO. And the test has been since been adapted as modified Allen test. So a negative Allen test means that the patient likely does not have an adequate dual blood flow, and the Allen test is done to assess the arterial blood flow to the hand. You can see that blood flow, how they are doing the Allen test, and the test can be done either in ulnar or radial artery. So the purpose to arteries supply blood to the hand. We know that one radial and another ulnar artery. And a healthy hand needs both arteries open and working. Otherwise, patient would get permanent hand damage. And mainly the test done to identify the vessels evaluated by the Allen test, or even we can describe the indication for performing the Allen test, and even we can outline the technique for performing the Allen test. Arterial blood gas test. Here the patient may need if they have asthma or any breathing problem or lung problem, and the sample is often taken from a wrist because there is a chance of needle puncture, and further it may be cause the problem in the artery, and the doctor may order the Allen test that the second artery is in good shape. And the modified Allen test differs from the original Allen test mainly by examining the radial or ulnar artery in one hand and then repeating on the other hand if necessary. Traditionally, it is performed by having the patient soft flexed at the elbow with the first clenched tightly to exsanguate the hand. And for wrist surgery, if the patient have a growth in the wrist near an artery, here the doctor wants to make sure that the artery supply is enough for its own before the surgery. So that's why we will do the Allen test. And even before bypass surgery. So sometimes the doctors use the radial artery from the wrist in the heart bypass surgery. So here the doctor would take the artery from the wrist to help clear a new pipeline for the blood to the heart. So for that the Allen test will be used. And even for kidney dialysis, and if the kidney is not working properly to filter waste products from the body, so here as an alternative, we will use the dialysis machine, and the dialyzer we will use with the tubes connected to the blood vessels of the patient. Here we will do the Allen test. It helps to find the best location of the artery for the dialysis. The test position, commonly we will do in the sitting position. So how we will perform the test? So in a patient with a normal patent arteries, the color should return the palms relatively quicker within 10 seconds. So here the examiner palpate and apply pressure to the radial and ulnar artery together at the wrist using 3 fingers on each artery. So when we are applying pressure to the arteries, this occludes blood flow to the hand. So here the patient make a tight fist. You can see in the diagram the patient is making a tight fist, and we will ask the patient to open the hand after hand 10 times, ending with the hand open. 10 seconds we will ask the patient to tight the fist. So here, after the release of either artery, if pallor persists within the palm after the patient clenches the feet and one of the arteries released, then the test is negative and indicative of an occlusion within the artery that being released. If you are taking an example, if the radial artery is compressed and palmar pallor persists, it indicates that compromised blood flow in the ulnar artery. And the same is true if the ulnar artery is compressed and palmar pallor persists, then the compromised blood flow in the radial artery. And even hyperextension of the fingers and wrist should not occur, as the tension of the soft tissue can appear white and leads to false positive. So here you can see the modified Allen test, the step. The first, they are giving pressure in the radial and ulnar artery. They are obstructing the blood flow, both the radial and ulnar artery, with the two fingers, the examiner, and at the same time press down on the radial artery. So here you are telling the patient to unclench their palm. So if it does not, you are applying enough pressure and start again. So if the test is negative, that is release the pressure on the ulnar artery, the hand flushes within 5 to 15 seconds. This shows that the hand has good blood flow. And if it shows that Allen test is positive, after releasing the pressure, the hand does not flush within 5 to 15 seconds and the circulation of the ulnar artery is not sufficient. In this case, the radial artery should not be punctured. And the palm of the hand should then appear white or pale. The examiner then removes the pressure from one artery, and we are seeing the positive test. It will take, we can wait for 5 to 15 seconds to return the palm of the hand and repeat the process while removing pressure from the other artery to assess the untested artery. So the diagnostic accuracy, sensitivity 758, specificity 817. That is 3-digit Allen test. So importance of test. So here the test is great at assessing the blood flow, and even the examiner can use to make this test more accurate. Even we can do digital plethysmography, duplex ultrasonography with the dynamic testing, and even you can use the pulse oximetry. And blood is limited in its ability to enter the hand. With the repetitive opening and closing of the hand, the blood is pushed out of the hand, which explains it at the point where the tester removes pressure from one artery. The only pathway for blood to enter the hands becomes the artery. So any return of color to the hand signifies good blood flow. So if there is a return blood flow within 5 to 15 seconds, it shows that the patient has a very good artery blood flow. So what the test results mean? So as I said earlier, the normal test color comes back within 5 to 15 seconds. And it means that one artery is healthy enough to supply blood to the hand all by itself. And if not, doctor may not be able to go ahead with the surgery or procedure, and he has to choose any another option. And the complications, while there are no complications likely to occur from the use of this simple physical examination, the more feared complication that can be avoided, and there may be a subsequent tissue loss in the radial artery is disrupted and the ulnar artery is insufficient to maintain the perfusion of the hand. And commonly we can see the tissue loss would be the most likely to occur in the thumb and thenar eminence. Thank you.